This is James Carter, and you're listening to Emergency Insights. Today, we're tackling one of the most urgent and potentially fatal conditions in emergency medicine: shock. Shock is a state of circulatory failure, where the body cannot deliver enough oxygen and nutrients to vital organs. The clock is always ticking when shock is suspected, and rapid recognition of the type and severity is essential for effective treatment and patient survival. Let's walk through the major types of shock we encounter. First, cardiogenic shock. This occurs when the heart itself fails to pump effectively, most commonly due to acute myocardial infarction. It's characterized by hypotension and signs of end-organ hypoperfusion. Despite advances in cardiac care, cardiogenic shock still carries high mortality if not promptly managed with interventions such as inotropes, mechanical support, and revascularization. Next, hypovolemic shock. This results from a critical loss of intravascular volume, whether from hemorrhage in trauma or from dehydration due to severe vomiting, diarrhea, or burns. Restoring volume quickly with fluids and blood products is paramount. Delay in resuscitation can lead to irreversible cellular injury and death. Now, septic shock. This form is triggered by overwhelming infection, often bacterial, leading to systemic inflammation, vasodilation, and capillary leak. It remains a leading cause of death in ICUs. Early administration of broad-spectrum antibiotics, source control, and hemodynamic support with fluids and vasopressors are the foundation of treatment. Anaphylactic shock is a rapidly progressing and life-threatening allergic reaction. It often affects the airway and cardiovascular system within minutes. Intramuscular epinephrine is the first and most important treatment. Delay in administration significantly increases mortality. Finally, neurogenic shock. It occurs following spinal cord injury or severe dysfunction of the autonomic nervous system. Hallmarks include hypotension with bradycardia due to unopposed parasympathetic tone. Management focuses on fluid resuscitation and vasopressors, along with supportive care for any accompanying injuries. In all types of shock, early identification and targeted intervention are key. Understanding the underlying pathophysiology allows us to move swiftly and decisively, saving lives when every second counts. Thanks for joining me today on Emergency Insights. Stay sharp, stay prepared.